Assalamu alaikum everyone and welcome to Dental Cassettes. We will be starting our new series on one of the lengthiest chapters of oral pathology, that is developmental disturbances of oral region. In this video, we will go through stages of tooth development, disturbances in number of teeth and disturbances in size of teeth. So briefly, recalling our previous knowledge, we know that the development of teeth is a complex process that starts from formation of tooth buds in the gums and ends with eruption of teeth into the mouth. So here is a simple diagram showing the different stages of tooth development. So the whole process of tooth development is divided into various stages on the basis of physiology and morphology. So the physiological stages include the initiation, proliferation, histodifferentiation, morphodifferentiation, and the apposition, whereas the morphological stages include the formation of dental lamina, the bud stage, the cap stage, the early bell stage, and the advanced bell stage. The initiation stage is when the tooth development actually begins. This is when the ectodermal and ectomesenchymal cells interact to form the tooth bud. The tooth bud will form the future enamel organ, which will eventually form the enamel. A defect in initiation process will lead to either an absence of tooth bud or an extra tooth bud. So as a result, there will be deficient number of teeth or more number of teeth present. So the disturbances in number of teeth could be anodontia, partial endodontia, and supernumerary teeth. Partial endodontia is further divided into hypodontia and oligodontia. Also, fusion and gemination could be a result of a defect in the initiation process. The cells in this stage are differentiating and developing into their respective types. It starts when the cells of inner enamel epithelium produce an organizing influence on the cells of dental papilla. The cells of dental papilla will differentiate into odontoblasts. These odontoblasts will form the first layer of dentine, which will trigger the cells of inner enamel epithelium to differentiate into ameloblasts. A defect at this stage could cause disturbances in the structure of enamel, dentine, or the cementum. So the fourth stage of tooth development is morphodifferentiation. During this stage, differential growth of cells occur, which means that cells will have different mitotic rates and different cell proliferation time. These differences in mitotic rates and cell proliferation time will result in different shapes and sizes of teeth. In this way, the associated anomalies during this stage of tooth development could be either disturbances in size or disturbances in shape of teeth. So just a quick review. Disturbances in number of teeth can be anodontia, partial anodontia, or supernumerary teeth. Partial anodontia is further divided into hypodontia, which is when less than 6 teeth are absent, and oligodontia, which is when more than 6 teeth are absent. From this point onward, we will discuss each of these pathologies one by one. Anodontia. Anodontia is a congenital disorder in which there is an absence of all teeth. In most cases, some teeth may be present, but they are defective and often conical in shape. Anodontia is mostly associated with hypohidrotic epidermal dysplasia, which is an X-linked recessive disorder in which there is an absence of ectodermal structures of the body. Here, treatment is limited and may include dentures and implants. Now coming towards hyperdontia and hyperdontia. Hyperdontia is when less number of teeth are present. It is more commonly found in the permanent dentition. It is often associated with other craniofacial anomalies. There can be two types of pattern to hyperdontia, that is symmetrical or haphazard. In case of symmetrical pattern, the sequence of most affected teeth are the third molars, then the permanent maxillary lateral incisors, followed by the permanent mandibular second premolars. Again, the primary dentition is not commonly involved, but if found involved, the most commonly affected teeth are the maxillary lateral incisors. Conversely, hyperdontia, or also known as the supernumerary teeth, is when extra teeth are present. About 90% of the cases are found in maxilla, and only 10% of the cases in the mandible. The pattern here is that mesodents occur more commonly than the paramolars, followed by the maxillary lateral incisors. Mesodents is a term used for an extra tooth present between the maxillary central incisors. Paramolars, also known as the fourth molar, is an extra tooth in the molar region. Again, in case of primary dentition, maxillary lateral incisors are most commonly affected. Hyperdontia is often associated with cleidocranial dysplasia and Gardner syndrome. Gemination is when the tooth germ attempts to divide during its development. This will result in either a partly or completely divided crown. Most cases of gemination occur in the anterior teeth. This condition is clinically and microscopically similar to fusion. However, we can differentiate between fusion and gemination by counting the number of teeth. In case of gemination, the total number of tooth count will be normal. Now, fusion is when adjacent tooth germs fuse together. The result will be anomalous tissues of the tooth. Its extent depends on the stage of development that a tooth has reached at the time of fusion. If fusion occurs before calcification, then the union will involve all the components of tooth, that is, enamel, dentine, cementum, and the pulp. In case of fusion, there will be one less tooth present in the arch. Microdontia. Microdontia is when all teeth are smaller in size than normal. There are three main types of microdontia. The first is the generalized microdontia, in which all teeth in both arches are smaller in size. The second is the true generalized microdontia, in which all the teeth are uniformly smaller in size. The last one is relative generalized microdontia, in which either maxilla or the mandible is larger in size, which gives a false appearance of small teeth. An important point to notice here is that generalized form of this disease is not so common compared to the individual types. So in case of individual tooth, maxillary lateral incisors are most commonly involved. Macrodontia. Macrodontia, as the name suggests, is when teeth are larger in size than normal. It is also of three types. The first is the true generalized macrodontia, in which all the teeth in both arches are larger than normal. This is often seen in case of pituitary gigantism. The second is the relative generalized macrodontia. It is when the maxilla or the mandible are smaller than normal. This type of macrodontia is often seen in case of hemifacial hypertrophy or with segmental odontomaxillary dysplasia. The last one is the rhizomegaly, in which the root of teeth are considerably longer than normal. Here often the cuspids are involved, mainly the mandibular cuspids.